Okay, yes, I can see. Just wait for people to coming in, I think.
I think the numbers are settling there. Ranjita, if you want to get started.
Right, so hello everybody, and well, good afternoon or good evening, or good morning, depending on where you are and which part of the world you are in. So a big warm welcome to the Royal Society for Public Health, Arts, Health and Wellbeing Special Interest Group webinar. And with me is Dr. Claire Howlin, and I'm just going to give you a little sort of an overview of this session. We've got sort of a number of sort of talks, and first there'll be Claire and I will give you an overview of our Creative Health Education Review, and this will be followed by Dr. Hannah Waterson. She is from the National Centre for Creative Health. She's the lead for research and policy, and we'll be talking about her publication, the Creative Health Review, which was published in December last year. And this will be followed by Professor Louise Yoni, who is a Professor of Medical Education at Queen Mary University of London. And we'll talk a little bit about the special interest groups that the National Centre for Creative Health hosts. And I'll be talking about my pharmacy SIG, which I chair, and Louise will talk about her GP SIG. And I'm really pleased here that we got Dr. Claire Howlin, who is an assistant professor at Trinity College Dublin, who is researching in psychology related creative health and psychology. And so Claire will give an overview of the first part of the talk about the findings, and I will talk about the recommendations and implications. And I haven't introduced myself. I'm Dr. Ranjita Dhital. I'm a lecturer in interdisciplinary health studies at University College London. And I'm also a pharmacist and a sculptor, so I love arts and sciences. And I'm really pleased to be kind of doing this webinar. And I wanted to say, we're very aware that there's people from different parts of the world here, very exciting. This creative health education is sort of, attracted the attention of diverse communities and audiences. And on here, there is a chat that if you have questions and as you're listening and you have thoughts, please post them on where it says Q&A with a question. If you hover at the bottom, there's a little sort of icon that appears. So if you have questions, you can pop your questions on there. But if you want to share thoughts and to talk just general, but not a question, you can pop your thoughts and ideas in the chat box. And we're really interested, please say hello, say who you are and where you are and what attracts you to creative health education and what you're doing. And the chat will be just here for us and for us to chat and talk. So I can see some lovely messages here. I can see some messages from my colleagues. Hello, Thomas Kador. It's in London. I'm in Kathmandu at the moment in Nepal on my research sabbatical. So it's nice to be connected with people from different parts of the world. So thank you, Claire. So over to Claire.
Great, thanks so much. So I'm going to take control of the slide deck now, hopefully, and talk you through this Creative Health Scoping Review that we did. It was supported by Arts Council England. The National Centre for Creative Health has helped us to design the scope and the scale of the review. And of course, the Royal Society of Public Health Special Interest Group for Arts and Health, which is hosting the event today. So if you're interested in this topic in general, I would advise joining in the Special Interest Group. We have a nice newsletter and quite a good number of people. I just want to see if I can click my slide. There we go. Brilliant. Here we are. So my own background, I have a joint background in therapeutic radiography or radiotherapy and psychology. And then I specialise in psychological mechanisms that underpin wellbeing effects of arts. I work in music and pain and music therapy for autistic anxiety. Ranjita works in pharmacy and also works as a sculptor and does a creative arts bachelor's and master's in UCL. And Mackenzie has also helped us quite a lot on this project. I want to mention her. She's specialising in the wellbeing benefits of art gallery and museum attendance, and she's based in the University of Vienna. That's our core research team. But of course, we had quite a lot of contributions and a consultation process with a lot of active practitioners in the field to design the scope of this review. So first, what do we mean by creative health education? These terms are broad and ever broadening, and there's no harm in that, having really nice, broad, expansive concepts when we talk about arts and health or creative health. But for the purposes of the review, we did need to demarcate a boundary of what we wanted to search for. So in this instance, we looked very specifically at performing arts and visual arts, and we took a broad interpretation of that. So it's slightly different from the medical humanities, but it does overlap with that area. But we're specifically looking at performing arts and visual arts, but including things like spoken word poetry and theatre, dance, drama, graffiti, all sorts of visual and performing arts. So we're then looking at specific educational activities. So we're looking at where these performing and visual arts have been used as educational activities. So they are embedding visual arts, performing arts, or creative writing as the primary mode of educational delivery. So this is how students are expected to learn. The reason we're interested in looking at this is because social prescribing is happening. It's happening in the UK. There's trials and pilots in other parts of the world as well, like Ireland, Scandinavia, and the US. And we expect to see a really growing area in this because the evidence is actually growing to support the wellbeing benefits of using creative health approaches for patients, but also has a lot of benefits for practitioners as well. It allows them to do experiential learning in very different ways. And really expand their professional development. The goal of the World Health Organization is to see creative approaches happening alongside routine care. And we do know that we have specialist practitioners like music therapists and arts therapists, and we have a growing specialty in creative health practitioners as well. And really, we want health professionals to feel confident in what they recommend and support, and that they're in a position where they know when to recommend a music therapist, whereas when to recommend a community arts group. They're very different things and can be used in different ways. We do want also health professionals to realise that there's different types of arts therapies. There's music therapy, art therapy, and dance therapy, just to name a few. These are all led by accredited registered professionals and governed by the IACP in the UK, and they're also governed here in Ireland. But the question I think a lot of health professionals still have is, do they really work? Are there really these tangible, measurable health benefits for people engaging in arts therapies and community arts practices? The short answer is yes, they do. They actually do work. Quite a range of approaches can work for health benefits for patients. Music has a surprisingly good effect on pain management. It can be used to help reduce both subjective feelings of pain in terms of pain intensity and unpleasantness, and also things like opioid and non-opioid medication. Art therapy is really useful for managing depression and schizophrenia, and there's actually a Cochrane meta-analysis that has been completed in those areas. There's also Cochrane meta-analysis for music and insomnia, music for dementia. And it's helping us to see how and where exactly these types of interventions might be useful and where we need to gather more evidence. In some areas, we do see there isn't conclusive evidence, but a lot of this is about the quality of research, so that there might not be a suitable comparator used, or there might not be randomization, or there might not be blinding, which are possible in creative interventions. We're doing a randomized controlled trial at the moment on improvisational music therapy. And we've seen randomized controlled studies in community arts, which are really practitioner-based. So these are really effective things. So that's kind of the baseline of why we want to educate practitioners on this in the first place. So we completed a systematic scoping review to identify what type of educational approaches are being used at the moment in the literature. We used 6 different databases. And here's a Prisma flow diagram to kind of show how we decided which studies go into our study. We did some double screening. We looked at the abstracts and titles first, then we did the full text analysis. And in the end, we identified 284 articles. The articles came from almost every continent in the globe. Here's a visual descriptor, which we're quite happy about. I have to acknowledge a lot of the research in this area is coming from the global north, but we do see growing research coming from South America and Asia and South Africa as well. So it's great to see that this area is growing everywhere, and to reflect that just one publication might actually reflect quite a lot of activity, because we know not a lot of educational work doesn't get published. In terms of the art form that people actually used, across these 284 published studies from across the globe, the most common way to work with the arts is to have multiple art forms. So a whole range of activities that students either experience all of them or one at a time, or they're allowed to choose. The next most popular then way of working is through theatre, working with theatre groups, asking students to either write, perform or watch theatre, and to use that to build their empathy and communication skills. So maybe writing characters of patients to develop an understanding of what it might be like to be a patient. Also for using to empathise with other health professionals and what it might be like to work in a health professional environment and working under the constraints of health services, which can be something that people need to empathise with as well. And then building communication skills through embodiment practice, which can be done through theatre or dance. So understanding what your body language might be telling a patient that you mightn't understand that you're communicating, and also using your body language to communicate compassion or care or messages of support, and ensuring that what you mean to say is congruent with the body language that you're using. So it can be really helpful for students that want support in communication skills. They're just some examples. The research we found is going back to 1994, which is almost 30 years of research in this area. So it's certainly not anything new. There's a lot of experience already developed here, and there's a lot of work to be drawn from. Some programs actually even exist for 10 years or more and are very well established and developed. But we can see that there's a huge increase in this area research kind of in the last, since 2012 or so. So it's something that's kind of gaining momentum. In 41% of studies that we found, students were asked to act as a creator, where they were asked to draw, paint, perform, dance, sing, or write poetry. In 34%, students were asked to watch, listen, observe, or attend art performances. And the reasons given for whether students were asked to act as creator or spectator were usually directly linked to the aims and outcomes of the educational program or curriculum. So when programs were hoping to improve students' observational skills like visual acuity and auscultation, they were then building programs that were developing those skills specifically. Whereas when they wanted students to engage in things like communication or empathy, often students were getting more involved creatively. Here's a breakdown of the different art forms by each professional group. So the highest professional group that we found, the largest, was nursing and midwifery here, who tended to use theatre most commonly, and were very similar in how they use multiple art forms and drawing or painting. And the theatre is used a lot for empathy, and that kind of would align a lot with nursing values that promote a lot of compassion and care. Whereas in medicine, multiple art forms were used most often. Allied health professionals are grouped here because overall you can see there's quite a small number, but this did reflect quite a broad range of allied health professionals, including not pharmacy because it's next separately, but occupational therapy, speech and language dietetics. Not much from dentistry yet, and not much from radiography yet, but there's loads of models already out there that I think all the professions could learn from. And quite a few in interprofessional studies, working in areas that are typically interprofessional. And then the arts, I think, kind of helps people to communicate in a new way that's new for everybody. So kind of levels the playing field when you want to work across groups. That's quite interesting. We find that the papers only reported that 9% were led by arts professionals, 33% said that they built their educational program in collaboration with arts professionals, but 53% of the studies did not mention working with an arts professional at all, which is quite, I think, somewhat surprising if you're trying to really build creativity into students. Not so surprising if you're used to dealing with educational and health system constraints, where it's not always easy to find the people that you need and ensure that the systems are there to support and pay those people as well. But given the wider kind of growth in this in general, I think it's something that maybe we could, really improve on in the future. Students were generally positive. We got 62%, not we, but the studies were generally finding that students were 62% positive. The rest were either mixed or negative. A common feature across the studies seemed to be that students liked these creative activities much more when they were embedded into their educational program and not as an add-on or an extracurricular activity. In general, if students are being asked to learn something, they kind of want to know why should they give their time up for it, and how is it going to help them be a better health professional. So where that was kind of communicated quite clearly to the students, they were much happier. A lot of studies did try to assess the outcomes, the learning outcomes, to try and establish if these learning outcomes were met. In general, this was done qualitatively, so it's almost impossible to say whether these programs are 100% effective or not effective. But verbal student descriptions did seem to say that, say, for example, for abstract outcomes like attitudes, we can measure attitudes actually quite easily using visual analog scales. And some students did admit to holding negative attitudes and things like that, and that they were changed through the program. So the last, but one of the most important things I'm going to talk about is the types of learning outcomes that have previously been addressed in the studies. And these outcomes are broadly grouped under professional development, decision-making, personal care, and then creative health. I'll bring you through them quickly. So the first one, professional development, was the most largely cited reason for bringing creative activities into health and professional education. And then under that, there was kind of 4 key reasons under professional practice. So to help develop empathy was the most popular reason for bringing these in. Empathy into the patient's experience, compassion, practicing vulnerability for health professionals, that they don't need to pretend that they don't have emotions, to develop sensitivity, but also developing a balance between being sensitive and knowing how and when to show their own emotional sensitivity and when to be allowed to disengage maybe from what they're working with, and then humanizing doctors and work with other health professionals. The next most common reason was for communication, where students, through a variety of different art forms, were able to develop their active listening skills, also conflict resolution, how to deliver bad news, non-verbal communication, and understanding figurative language that patients might actually use, a completely different vernacular that our health professions might be used to using in our university world and in our health systems world. The next reason that people mentioned was helping health professionals to become prepared for practice, and help them to develop person-centered care, which is a really important element of professional registration for quite a wide variety of health professional groups. And in this, they were helping students to develop comfort with ambiguity, to understand that things can be subjective sometimes, that maybe there isn't always objectivity in what people say. That people need to have cultural sensitivity to all sorts of minoritized groups, ethnically minoritized groups, sexually minoritized groups, rural groups as well are sometimes left out. So having cultural sensitivity seems to be, we know it's very important, but it's also something we can build on through culturally sensitive arts activities. The research also tried to highlight how the social determinants that there are so many social determinants of health and healthcare that health professionals may not be aware of. So some of these wider issues like disadvantage or disconnection, and how that can kind of lead to poor health outcomes that people have. And another topic that came up was helping health professionals to become aware of and comfortable with power dynamics in all types of healthcare interactions. One of the last, but in this particular section, but very, very important, is the role that the arts can play in challenging unconscious bias. And really important concepts have been addressed already through like the theatre of the oppressed, such as racism, ableism, and helping to make sure that we destigmatize patients with specific illnesses such as HIV, psychiatric illnesses, addiction, and disabilities, which can all be stigmatized actually by health professionals. So just helping students to become aware of some of these unconscious bias that they may hold, as we all do, or all can do, and addressing them at an early stage in their education and in their career. So just to give a quick example, this is a study by Singh, and they did a project to try and help change students' attitudes. And working through the theatre, they found that learners were able to think beyond the hegemony of normalcy and show an understanding of diversity, dignity, autonomy, disableism, social inclusion, equity, and universal design. They admitted to the misconceptions that they carried and showed keenness to advocate for change. Quite powerful what could be achieved in one programme. And that was in Assam in India that study was conducted in. The next theme, the next ones are a little bit smaller, but equally important. The next topic that people were using creative education activities for was to help students with clinical decision making, sometimes really directly by helping them to develop creative thinking skills, so problem solving, critical thinking, and meaning making. So all different types of thinking, both convergent thinking when you need to solve a problem quickly, and divergent thinking when you need to improvise and think outside the box. You might be able to get what you want, but you still need to find a solution. They were used in some very specific ways to help with specialist knowledge and different types of competencies. And these are some that really jumped out as being addressed a number of times, particularly anatomy, palliative care, chronic illness and disability, psychiatry, pharmacology, and public health. And obviously the types of arts that would be used in each of those topics would be entirely different. So drawing and painting is used an awful lot for anatomy, whereas poetry is used an awful lot in palliative care. So very different specific competencies being developed through different art forms. Clinical observation skills were brought up a lot, particularly with visual art, bringing students to art galleries and museums to look at abstract art to help them develop visual acuity, auscultation, skills for hearing. Some beautiful music cognition programs were actually developed by one group where they asked students to listen to all sorts of sounds and music, environmental sounds, minimalist, baroque, all sorts of things, and try to help them recognize what sounds feel like and what they might feel like for patients as well in inpatient settings, and what we can do to adjust those sound environments for patients to make them more comfortable, and physical assessment. So an innovative combination of music education activities to develop the students' ability to distinguish individual sounds, such as hearing, appreciate patients' experience of sounds, and improve their auscultation skills, and reduce the negative effect of noise on patients. That was done by Collins. It wasn't a direct aim of this project, but we did find that alongside some of those main themes, that a lot of people were also noting that the arts could be introduced to help students with their own well-being and personal care, to help build their confidence, emotional literacy, prevention of burnout, self-care, relaxation, stress management, spirituality and enlightenment. There's a lot more research on that, but that wasn't the focus of this particular review. But this is like 86 of the studies that 86 of the papers that we collected did flag these as kind of secondary educational aims. So you can kind of meet those mandatory aims and doing it in a way that's conducive to emotional well-being. And to just clarify, it's not about encouraging students to kind of gush all their emotions out there, but helping students to learn that balance of how to regulate their emotions according to the situation that they're in, and how to de-stress, and maybe when they're away from patients, and the importance of doing that. Last but not least, and then I'm going to wrap up on this and hand over to Ranjita, is the number of studies that actually focused on creative health itself. So what are we teaching our health professionals that are not specialized in arts or music? What are we teaching them about arts and music? And very little is the answer. We're not really telling them about how much really high quality research there is out there on how creative interventions can be used for a whole range of health outcomes. Very little information about arts therapies and music therapies coming through. And often I did notice people using the terms arts therapies and music therapy incorrectly to describe music interventions that don't have an arts therapist involved. So really important to flag that if health professionals are using music or creative arts in their practice, it's not the same as an arts therapy or a music therapy. And there's loads of creative activities that happen outside of hospitals and healthcare, cinema, music, all these different things that don't have to be called an intervention if they are an everyday activity, even though they may have health and well-being benefits. So I think there's lots that we could still increase on our educational platforms to enhance students' knowledge and awareness of these different topics. And a lot of students are asking for this. There's a lot of papers from nursing students really asking for good quality information on these types of interventions. What are they? What are they for? All right, so that's it from me.
Thank you very much. So, sorry, Louise, Yoni, your hand.
I can't hear you, Ranjita.
Can you hear me now?
Try again.
Can you hear me now?
Yeah.
Yeah, great. Okay. I need to go back the slides. Megan, I don't think I can control the slides. Do you want to go back to the key findings one? Great, thank you. I know why. Okay, so I'm just going to give an overview of the implications of the findings that Claire has presented, and just wanted to highlight that you know, the idea of enhancing professional practice. I'm a pharmacist, and all sort of healthcare practitioners and professionals. This is said, and this is sort of advocated by our education councils. And what we're finding is that the benefits and the kind of enhancement that creative learning can do was, in sync. It complemented it. We were speaking the same language. So this highlights that creative content learning, it shouldn't just be a module or an optional module or even a compulsory module. In fact, the content should be integrated into the curriculum. So we're talking about kind of a radical change, a rethink of the curricula. So and it complements what is needed in terms of health education, learning and practice and continuing professional development. So person-centered care, dealing with ambiguity, well-being, readiness for practice, equality, diversity, and inclusion were all kind of things that we found in our scoping review that highlighted there were kind of benefits and positive gains, or things to look further into, to test further, to evaluate more deeply. So that was really interesting and important finding. Thank you, Megan. The next slide. I don't know why I can't change. Oh, I can. I did it. Okay. Involving art professionals, as what are highlighted, very few studies that actually included art professionals, and it kind of highlights, maybe current educators in health don't have the experience or know how to work with arts kind of practitioners. And what does the education team look like anyway in a university? How do you invite creative practitioners in your education team and your university, in your department? So these are really interesting ideas that would need further exploring and sharing knowledge and experiences of that, because we did find published papers where there are teams in education teams that is very interdisciplinary and some are not. So this was an interesting finding, and we acknowledge there are challenges to this, but at the same time there's real opportunities of involving art professionals, and the education and the impact is more kind of profound through doing that. And the third finding, the low quality or the low quantity of sort of information describing what creative education is. And so it highlights the language and how we talk, the discourse of creative health, and how we um, describe it, how we write about it, how we communicate about it. Because some of the content was described as music therapy, but it's not really a therapy. It was more of a form of practice where music was applied to enhance learning, but it wasn't a therapy that the students were getting. And also some of the instructions of drawing, that they were students were given instructions quite too instructive. And the educator had misunderstood that the art content should be more exploratory. It's looking at the unknown and supporting the students' development, that their curiosity and being comfortable with ambivalence, as what Claire highlighted previously in the finding. And also things like, music medicine. Well, what does that mean? Does that mean that's an intervention? It's a therapeutic intervention. So students, so there should be more clarity in the aims of the creative content in the education to be delivered to students. So that was one of the key findings. And this is the finding, we called it the reviewing the education philosophy, introducing creative health content. It's really kind of questioning what is the creative content in health at the moment, or how do we integrate it? What does that mean? Does that mean that what we have, all of it has to be removed, has to be changed? And so it's working with what we currently have and seeing, creative content to bring it in, not as an add-on or or like an optional things, but to actually looking at the heart of what the curricula is made of currently. And when I talk about the philosophy, also about equitable sort of knowledge, most of the studies, which is the case in many kind of different research areas, are from the global north, 87%. But in health, this is sort of health education, the most sort of worst disparities and the most negative experiences of health are experienced from low middle income countries, and here like 80% experience the disability and death from the non-communicable diseases. And but we were very kind of heartened to find that there were still studies published in many parts of the world that were embracing creative health regardless of their education infrastructure and system. And so there's a kind of real appetite to develop this. So it shows that maybe this kind of knowledge, this kind of creative health knowledge, is a more an accessible form of teaching. People can engage with it more. It kind of, people see a natural affinity towards it. So this has a potential to really develop like an equitable knowledge exchange across East and West, because it seems to be that many parts of the world are involved in doing this. And I wanted to highlight this scoping review is the first of its kind where it's looked at publications from around the world on just to map out what is going on. So here I've kind of highlighted it with those three sort of crosses here in the circles of creative pedagogical research and evaluation. So to understand what's really going on, the publications that we found, most were all qualitative and but a standard qualitative. They hadn't used what we called creative methodologies. So the different types of methods that we can use to understand the impact and the development of new types of creative education, creative health education. So it calls for different types of research methods, pedagogical research in this area, and also to examine the curricula in a more kind of deeper way, rather than to add bits of things here and there, but to actually look at the fundamentals of what we teach and why we teach, and calling for interdisciplinary working between the arts and sciences, and also interdisciplinary working between the professions as well. So that was my fourth. And then the final one is the evaluation. This one we found in the papers that were published about students and what they thought, and like involving students and really being clear about what you're teaching. I think a lot of students may have come into the health profession from a science background who hadn't thought about the arts, and things are new and confusing for students, which I can imagine as it is for the educators. So sort of clarity in that. And I think as this area evolves, you'll probably likely to attract lots of different types of people into healthcare that we don't have currently. So therefore, this is quite an exciting field. And I have my last slide here. I think that's it. Yes. So thank you very much. And next is Hannah Waterson. So thank you very much. So we will go straight into the next speaker. And I just had a question about the slides. We will be sharing the slides with everybody who's attended the webinar today. Thank you.
Brilliant. Thanks so much, Ranjita and Claire, for taking us through your research. You've covered so much in that short space of time, and so I'm really looking forward to reading the report as well. So I'm Hannah. I'm the Research and Policy Manager at the National Centre for Creative Health. And this topic around creative health education and training is one that's really important to us in working towards our aim, which is to create the conditions for creative health to be embedded across health, social care and wider systems. Ooh, and there we go. You can see here that this is a recommendation made by the 2017 All-Party Parliamentary Group on Arts, Health and Wellbeing Inquiry Report, Creative Health. And that report made a recommendation that the education of clinicians, public health specialists and health and care professionals includes modules on the evidence base and use of the arts for health and wellbeing. And it also recommended that arts education institutions initiate undergraduate and postgraduate courses related to arts and health and wellbeing. So more recently, as part of NCCH's Creative Health Review, we looked at the progress that had been made in this area and what was needed in order that creative health can be incorporated into clinical training, and that training and professional development for creative health practitioners is supported. So the Creative Health Review ran over 2023, and we published our final report last December. It made recommendations for a cross-departmental creative health strategy at national government level, and we're now continuing to make that case with the new government that's in power. And the review provided evidence and examples of how creative health is helping to tackle some of our pressing policy challenges, so including health inequalities, pressures on the NHS and social care systems, and rising levels of poor mental health. And then also we looked at what's necessary for further integration, so how to spread, scale and support this work to ensure that it's available equitably across the country, and that it's applied more widely in order to really maximise that potential. So it's as part of this section that we were looking. So I don't know what's the slides have gone slightly out of sync there, but so I've ringed education and training because we were looking at education, training, workforce development, and we hosted a roundtable with a range of expert speakers, actually including Claire and Ranjita, who provided us with an earlier update on their scoping review. And you can find all the information about this topic and some other case studies and resources on our website, and I'll pop those links in when I finish speaking. So in researching this section of the review, there were several areas of creative health education in the UK where there's some really exciting things happening. So some of those types of opportunities that came up included postgraduate qualifications, specifically in creative health. So in addition to those long-standing accredited courses in creative arts therapies, we're seeing master's level courses specifically in creative health. At NCCH, we work very closely with the UCL, University College London, Masters in Creative Health. And in that course, the students cover a diverse curriculum, including health inequalities, lived experience, research methods in arts and health, and non-clinical and community-based approaches to health and wellbeing. As another example, Plymouth Marjon's MA in Arts, Health and Wellbeing explores the use of creative practices to support health and wellbeing. And that's just a couple of examples, and we know that there's some more under development as well. And we're also increasingly seeing creative health incorporated in undergraduate and postgraduate education as a module or as a placement opportunity. So, for example, NCCH has recently contributed to a module on creativity as part of an occupational therapy course at Sheffield Hallam. The University of Manchester runs an arts and public health module as part of its Masters in Public Health. In our roundtable on this topic, we heard from the University of Chester, whose undergraduate students undertake a creative health placement in year 1 of their training. You can see them up here doing so. And I think the course leaders are actually with us today as well, so feel free to add more detail in the chat if you'd like to. As part of this programme, the students work with artists and creative health practitioners, and they explore dance and music and visual arts, and they learn through experience, and they use creative techniques as well to reflect on their learning process. And they also have the opportunity to see creative health in practice in the healthcare settings and communities that they'll be working in. There's also an Arts, Health and Wellbeing Centre at the University of Gloucestershire, and that's working in partnership with the local integrated care system. So that will provide creative training opportunities for the health and social care workforce. So often creative community and cultural organisations are key partners in the delivery of creative health training. To give a couple of examples from the review, Tyne and Wear Archives run a placement for occupational therapy students, looking at how museum artefacts can be used to support health and wellbeing. As another example, the Still Parents Life After Baby Loss exhibition at the Whitworth Gallery in Manchester has led to real changes in the way that local healthcare teams engage with bereavement. And there's now a strand of work called Still Care that includes training for student midwives, providing them with skills and knowledge to support bereaved parents. So creative health as part of clinical education or medical education has been used for some time, helping students to develop some of the skills that Claire's just talked about: empathy, communication, and person-centered care. Encountering those creative approaches as a student informs future clinical practice. So, for example, we heard in our roundtable that medical student leads from the Global Social Prescribing Alliance had worked really hard to ensure that social prescribing was represented in their medical curricula. And that's really promoted an understanding of the importance of holistic and patient-centered care. But as Claire's just touched upon, embedding creative health into clinical education in this way is not only about promoting creative health as an approach that can be used with patients, it also supports the health and wellbeing of the students themselves, and it provides them with tools for self-care as they progress through their career. So, for example, Louise Uni's work on flourishing in medical education takes this approach, using creative inquiry with medical students, allowing them to explore their emotions and vulnerabilities in a safe space, and to connect as peer support. And Louise is with us as well, so she might want to expand on that too. So we're seeing increasing opportunities for creative health education within universities and in higher education settings. In our roundtable, we also looked at training and professional development opportunities for practitioners that are currently working in creative health. So research by the Culture, Health and Wellbeing Alliance, CHWA, who are the membership organisation for creative health, tells us that many more creative health practitioners come to this field via their personal or professional experience, rather than via higher education routes. And among CHWA's membership, the demand for training and support for professional development is high, but opportunities are scarce, and funding structures, particularly for small organisations and freelancers, can make it difficult to incorporate this into their work. So the CHWA Quality Framework makes recommendations to commissioners and funders for investment in support, supervision and training. And the wider principles of that framework can also be used to underpin what this might look like, and I'll pop a link to that in the chat as well. And then the need to develop a diverse and representative workforce was also highlighted in our sessions. There's some great programmes like the Artists Represent Recovery Network in London that's supporting ethnically diverse artists to develop their skills in creative health. But I think it's another recommendation for us at NCCH to also keep a focus on how the sector and its workforce grows in an inclusive and equitable way. As Ranjita and Claire's scoping review and also our work through the creative health review shows, there are increasing opportunities for creative health education and training. Where this work's happening and its impact might not always be published or well publicised outside of our networks. So I think there's definitely a role that we can play in identifying what's available, what good practice looks like, and what gaps exist. And then finally, I just want to highlight a couple of opportunities for professional creative health networks that we host at NCCH. So these provide peer support, networking, and knowledge exchange. We have a GP special interest group with over 50 very creatively minded GPs who come together to discuss their ideas and experiences. And Ranjita also heads up the International Arts in Pharmacy Special Interest Group. And I will put some links to more information about those in the chat, but I think I can hand over to Ranjita and Louise to give a bit more on that.
Thank you very much, Hannah. I think Louise, yeah.
Hi there. I think I need to be pinned. There we are. Hi there, everybody. So I'm Louise Uni, and I'm GP and Professor of Medical Education. And just a tiny bit of background, I've been exploring creative inquiry for over 20 years. That is exploring our lived experience through any of the arts. Firstly for person-centered care, but latterly I realized that as we humanized the patients, we also humanized the students. And so I started exploring a move from resilience, toughing it out, bouncing back, and the sort of macho approach to well-being, and moving towards flourishing, and latterly even towards flourishing spaces. So what spaces can we create in healthcare or in higher education that would be a flourishing space where people can grow and learn and develop in creative agency and find their voice. And so that's what we've been researching and exploring in practice. But I also co-lead the GP SIG, which is supported by the National Centre for Creative Health and is linked to the Royal College of General Practitioners as one of their SIGs. And I co-lead it with another GP, Dr Kathleen Wennerden, and also Alexis Butt from the NCCH. And you can see the broad aims, but essentially flourishing is our sort of highest aim around promoting well-being through the arts and creative practices for patients and for clinicians. And we're looking to see how we can transform and enable culture change in our practices, as well as enhancing scholarship and practice at all the different levels across primary care. We meet 4 times a year online, but we also have an away day, which is coming up in about 2 weeks' time in London. So we're excited about that. We've been going for about 2 years. We also have some regional leads. We've got 4 so far across the UK. We have we have some newsletter, and we have some sharing of practices and case studies. And if Hannah hasn't put it in the chat, I'll put in both the Padlet where you can see some of the case studies, as well as the link to our website. And you'd be very welcome to join, get involved, find out more. We're still exploring, best ways forward. I think we're going to be linking more with the Royal College of General Practitioners. They've become more interested in their SIG lead, so there might be more potential to reach out that way as well. And we invite anyone within the primary care, so it isn't just GPs, but anyone who's working within primary care who's interested in the field. Ranjita, over to you.
Very much, Louise. Just the next slide. I don't think I can change the slide. Oops. Megan, oh, thank you. Yeah, so the NCCH also has a pharmacy SIG, and we're fairly new, and there's been different types of activities around our SIG, and I put the links to both the SIGs here on the chat, the GP SIG that Louise spoke about, and also the pharmacy SIG. And if you go link on the website, the pharmacy SIG is open to anyone to join. And if you do, you'll go on our mailing list to receive updates about online events and other activities we could develop in future. So this SIG is forming, and we're quite keen to kind of create a program of events over a time. And the aim of this SIG is really to kind of stimulate this sort of creative possibilities. That sounds so broad, but really trying to map out, what creative activity is happening in pharmacy, in arts, and in sort of different setting, in practice, in education and policy, and try to sort of bring it together and connect each other and share and create a platform for dialogue and discourse. And we also want to promote creative research practice in pharmacy, and are very interested to look at creating new forms of knowledge that can inform policy and practice. So it's quite an exciting space, and to innovate education is what this scoping review will do. And I can see us actually having a separate sort of online event in our pharmacy SIG to kind of to explore those pharmacy studies that Claire and I and our team found when we were doing the scoping review, and what it means for future design of pharmacy education, how to bring creative content into that. So I'm really, really pleased, and I've got a lovely image here which promoted this webinar is by Peter Fagan, a pharmacy student, and there was it was led by Dr. Marie Allenson, and at Keele University at the time. And I didn't know before I met Marie that there are creative modules in pharmacy curriculum happening in the UK. So this SIG really kind of gives us an opportunity to know what's happening nationally and also internationally, because this is an international SIG. So thank you very much. And this is, so we can stop sharing our slides. We have these slides will be available to you, and the next slide are some references. I can't change that. Thank you. And thank you very much for listening and being with us today. So we've got some, if you have some questions, I know that we've seen some questions that were posted, and yes, the scoping review hasn't been published, but it will be published. So we're finalizing that, and it will be available hopefully as an open access publication. And like I said, we will disseminate in different ways to different groups and organization. It's not just going like what we're doing today is that kind of one of our first attempts at kind of communicating to the wider audience. Was there any, I mean, I can see the questions which I know that there were kind of more comments. There's a question about funding available to the third sector organisation to scale up their creative work so they can also contribute to research and practice.
Ranjita, are you looking at the question and answers box?
Yes, I'm looking at that.
Oh, there's one at the top. The first one that came in, there's a few at the top. The first one that came in is from Ulysses Moreno Serena, and she's asking about artist's identity. So I'll just read out the question. She says, hi, in my doctoral dissertation, one of my findings is about how getting involved in the applied theatre practice stresses performers' identity. Do you think this could also happen within the arts and health practice, thus impacting how artists are called upon and collaborate in projects? It's a very interesting question. I'm interested in this because I've worked a little bit around social identity and how that can develop through community arts practice. And we find that people can develop an identity through regular engagement with the arts. So in the first instance, I would say yes, if you're working in this space, it will probably affect your identity. But I think how you describe yourself will be what affects if people reach out to you or not. I would love to hear what Ranjita, Louise or Hannah think.
Thank you. And, this scoping review, what it highlights is we want to integrate this creative thinking, the creative understanding in the curriculum. And that is kind of quite shaping and formative. It forms your practice, and it allows different types of opportunities, and making you more of a compassionate practitioner, as we found that our students from the scoping review reported in the evaluation that we identified. But maybe Louise, you'd like to add, or Hannah, to that question?
I didn't fully understand the question, actually, which makes it a little hard to add. I didn't fully understand, in what way, how impacting how artists are called upon and collaborate in projects. I wasn't sure how it would. I must be missing something.
I'm going to move on to the next question. The next one then coming in order, I was going to is coming from, I've typed answers to a few questions as they were coming in just because we're tight for time. The next one is how the research designed reviewed the work of art colleges, schools or institutions that are leading pedagogically in this space and their value or role in supporting, informing medical and health or clinical care programs and courses. So I suppose the question there is asking, how did we involve art colleges, schools and institutions? I'm going to give a quick answer to this again before I hand over to the panel. So when we were developing the scope of the review, we reached out to as many networks as we could through the National Centre for Creative Health. So I'm not sure how many art colleges are involved with the National Centre for Creative Health directly. But we invited like anybody that wanted to get involved to help shape the review and, you know, contribute to the design of it. So we did a consultation process over the summer of 2021. Some of the papers that we report are published by academics in art colleges. So where anyone has published a paper in that area, it will have been included. But as we can see that there's much fewer papers coming from an artist-led perspective than a medicine-led perspective or health-led perspective. I think on a small number in between working collaboratively, and I think we need to maybe move into the middle so that we have joint approaches where we know there are some, not some, but we know that these approaches are very well developed in some spaces. There's pockets in locations and institutions where this happens. I'd love to know more, and I'd love to see some of these art colleges, schools and institutions join in with the network and share how they work, or if there's any opportunities for people to link in or work with them, or if there's a lot of people in the chat looking to work with art colleges. I think we'd love to get them involved. If there's any way to kind of do that, if people were open to having loads of lovely health professionals coming into their art college and experience things from a totally different way, that'd be great. And just a few examples I've seen where people actually have done it in the past, where they train health professionals and art students in the same class at the same time with the same curriculum. And I think that's very exciting. And each group learn from each other. So the art students learn from the doctors and the doctors learn from the art students. They're all paired up together and asked to do a range of tasks. And it really shows them, they learn a lot about how they think. And it's a really interesting way to work. So I think that's something I would advocate for if that's possible.
I would just add that we've got sort of a really broad network of people that sort of join up to our mailing lists and are involved with NCCH, but we are always keen to find out about any further initiatives. So if you've got something that you're running that you want to tell us about, please do get in touch.
It seems like the next question and Victoria's question are both perhaps overlapping, and maybe I could speak to a little bit. So we've got Sarah Hoover talking about, given your finding from number 2, what investments or recommendations for investment are being made in developing capacity and infrastructure to support artists and arts therapists to take their place in multidisciplinary creative health education teams? And Victoria Hume has also written further thoughts on how we can tackle the 53% of work undertaken without professional artists, echoing Zoe's findings. I think it's difficult. It's still, as far as I can tell, and I've been trying for 20 years, just to be bringing people in ad hoc kinds of ways and to organise payments. I think there's a growing case for it, but it's not yet hitting at higher levels. I think this is a growing field, and perhaps as the case is made better, but at the minute I don't see my own medical school or others, employing. Wouldn't it be great if we had? Well, so it would be good to work with a team of different people, but maybe having someone in permanent employment. It's always difficult to be bringing people in temporary because there's a lot of, I do a lot of that, but it's difficult to organize, difficult to pay. So it feels like there's more work to be done, I think, and we were talking about this, Claire and Ranjita, earlier, about how some of the things that the Royal Colleges and for example, the GMC or RCGP, whatever, some of the aims and even within the medical licensing assessment, some of the aims of what we're trying to do within the policy is calling for. I think that some of the creative health stuff can reach those parts that other methods do not reach, and it's somehow making that case clearer. So maybe the case needs to be made clearer to the people that are holding the money, and it's a work in progress. I don't know if you want to add into that.
No, thank you very much. I'm just conscious of time, kind of reached the end, but I think what you said, Louise, and this is a scoping review of, we were so felt brilliant that 284 studies. We didn't know, it's never been scoped before, and there's been 30 years of work in this field, and in fact that hasn't been communicated to the education councils and the royal colleges. So this is new information already. So there's already been a start. And what we're looking at talking about here, Louise, you're saying, is changing policy and the curriculum content and making it integrated, as opposed to currently it's been an add-on, or you're doing things voluntarily. In addition to your normal teaching, which is your health education teaching, the creative teaching becomes an extra work, which is actually a lot of us have been doing. I have done that. Louise has done that for many, many years, and this is news. And that's why we have the special interest group that the NCCH that Hannah, and we talked about. This is all advocacy, and it's actually, communicating this, going to meeting with the educational councils, going to different organisations, actually saying, this is the evidence, this is the new types of research we need. The current methods haven't really answered this, but these things exist, and it hasn't captured the reality. So I think when we say a lot of work, it's not actually starting from scratch, it's actually reformulating and presenting and communicating. I think that's probably going to be the key in creative health education, is the communication for change. Sorry,
Can
Liz,
I just
you want
say,
to say? Yeah,
just
sure.
one more thing, just Ali Winstanley's question there about a creative health educator network. And what I was really struck by, and I was going to say, so many people messaging in the chat. So the people that are here kind of listening are trying to connect with each other and have so many links and so many things to offer and to share each other. It feels like there's, that would be good to capture, enable. I'm not quite sure how, but I just wanted to highlight that before we finish.
Thank you very much. And I think this has been such a popular event, and I can see like Claire and I talking and discussing, and we'll also talk with the NCCH and the RSPH about next steps and what to do. And we're really kind of humbled by all your kind of engagement with all of this. It's been wonderful. And I think there's something that we will take further and be in touch with ideas. And we're going to keep all the chats and the things that you've said. I'm not very good. I'm quite a slow reader, so I haven't actually been able to capture and in depth all the things that you've been saying. So shall we, is that okay? I'm sorry that we've not had a chance to answer all your questions, but we will keep them. There wasn't anything else. Any final words from Hannah, Claire, before we end?
No, I did notice that there was a link up made in Southampton. Shirley and Michael have found each other. They've managed to connect somebody that was looking to work in this more, and somebody that had resources. And I can see Rotherham, somebody has sent an anonymous message from the council in Rotherham. They're looking to do a creative health programme, and I think we've had some other participants from that area. So there's lots of connections happening all over the place. Sorry to anyone that hasn't found the connection they were looking for today, but we do have lots of different events and on different topics, so please keep involved.
Thank you, Claire. Hannah, any last words?
No, just it's great to see so much excitement and enthusiasm in the chat, and as you say, people making connections. There's a lot going on across the country, and it's really good to hear about it. And thanks for everyone for joining today.
Thank you very much. Okay, goodbye, everybody. Thank you.
Bye, everyone. Thanks so much.